Hi, welcome back to Rohrich Knows podcast. This is Dr. Rohrich. I'm a board-certified plastic surgeon in Dallas, Texas. And today we're going to talk about plastic surgery gone awry or gone too far. And really, the beauty broker really has helped to calm the waters and to say, hey, let's get back to the reality of real plastic surgery. So I'm actually going to interview Melinda Farina today, who is the beauty broker. And how are you today?
I'm great, Dr. Rohrich. How are you?
I'm great. So Melinda, it's so great to have you with us. And I love your social media, especially Instagram. You kind of really like hit it right on target. You're always about safety. You're always about outcomes, about doing the right thing. And I think social media has just kind of confused everybody, and it's kind of gone awry from, big buttocks, big implants, big lips. What's happening out there? And then it's so non-believable. And how do we get it back to normal? What do you think we should be doing?
I mean, there's, it's a twofold problem. I think that social media is both a blessing and a curse for our industry. I think that it's given a lot of wonderful people a beautiful platform to raise their voice and teach the right way. And then it's given some not so serious people who are kind of making a mockery and a joke out of our industry, and people who don't really have a beautiful aesthetic eye and putting really distasteful work on the internet, and people thinking that that is actually, beautiful aesthetic work. And I think this is kind of where our industry as a whole gets a really bad stigma attached to it, right? It's like the bad surgery gives us the bad stigma. And a lot of that, overdone filler, overdone fat grafting, overdone, body sculpting and ab etching and overdone implants and just everything overdone, overpulled, overlifted. That is not something that is natural. That is not something that is beautiful. It gives our whole industry a bad name. And then you have the really tasteful, wonderful surgeons who do everything by the book, cross their T's, dot their I's, care about safety, run an ethical practice, wonderful follow-up, wonderful patient care, educate the right way for the procedures, how to carry out those procedures safely, how not to do too many per day. That's the beauty of social media, and giving people like that a platform is wonderful. But things have gone a little too far, especially with like trends in plastic surgery, because as we all know, trends are fine for clothing, trends are fine for interior design, trends are fine for a haircut, trends are fine for makeup and fashion. But when it comes to permanently changing one's face and body, that is where I draw the line with trends.
Right.
No one should follow trends when it comes to plastic surgery. End of story.
I agree. That's so true. And because, you can take your shoes back, you can take your purse back, you can't take your nose or your face back. And I think that's the big thing here. And I think you and your company have been, I think, a great equalizer in saying, hey, we got to stop this and get back to, where it's always been, real great plastic surgery, done safely, done well, and not out of focus. I mean, the trends of, where people are saying, I want to be a Barbie, I want to be a Ken, I want that fox look, I mean, it's craziness out there. And yet you have major influencers that are sometimes advocating for that. And so how do you get them to say, hey, enough is enough? I mean, when your clients come to you, you say, hey, that's just not possible, right? I know.
Right. I don't think I'm this like old stuffy consultant, who like wears the pencil skirt and the suit jacket. So I feel like I'm a pretty young, hip gal, but I was trained by very serious surgeons. So, I usually say what's unpopular, but it needs to be said. I feel like I say a lot of what people are thinking, but are afraid to say because it's trending, it's gone viral. And if God forbid you talk against it, you're going to have a million haters. I don't mind the haters if I know the advice that I'm giving is great advice, that it's good guidance, that it's good education, and that it's going to save people from having multiple regrets later on in life. I don't mind saying what's unpopular. And I think more of us who are serious in the industry, and I know that you do it, and you do it with your journal, and you do it with your teaching and your fellowships, that you teach the right way. And, people who want to educate others or the laymen, and especially other practitioners in this industry, how to do things the right way, need to raise up their voices and speak out loud and make these points clearly and loudly on these platforms. Again, yeah, I have a lot of people who aren't really in love with me, and they can't stand my guts, because I'm talking against things that I don't fully believe in. But I always echo the teachings of my mentors and how I was taught. And, I really firmly believe that when we work with clients, that we're getting them really beautiful results that are long lasting. And it's things that it's classic. It's not going to leave them with regrets later on in life. And I feel like we see so many of these young girls in their 20s, in their early 30s. I had a girl today come in. She was 26 years old, Dr. Rohrich. She didn't need a facelift, but she had a deep plane facelift, fat grafting, a brow lift, rhinoplasty, lip filler, platysmoplasty at 26 years old.
Really?
What? So why? Why is that? When I see things like that, it makes me so angry. I'm like, okay, I know there's this deep plane phenomenon happening across the board in our industry, but girls in their 20s should not be getting deep plane facelifts. I'm sorry.
They should be getting a facelift. They shouldn't be getting
a facelift at all. Unless it's a weight loss case, and there are certain cases where, of course, there's laxity, we need to fix it. What we see, we fix. However, I think so many of these procedures have gotten way out of hand and over sensationalized, and it's not safe for these young, impressionable, men and women, especially, getting all sorts of weird implants on their bodies, doing too much, or going too large too soon with the breast implants. They don't realize, if I don't like them, I'll take them out and go smaller. No, you're going to need a lift, and that is going to require incisions. And, they're not educated the right way. So I think having advocates and having somebody guide them through the process in a safe way, where we're still going to get them a really decent, tasteful result, is important, because people are falling victim to too much of this, especially with the injector stuff. There's too much of the filler stuff happening, too much of these PMMA fillers that people don't realize really, really hard to get rid of. Too much of the silicone injected in their lips or, in their buttocks, and they don't know how to get rid of it. So people are ending up disfigured, having to go through very painful surgeries a couple of years out to try to reverse what they've done or the mistakes that they've made, just because they simply weren't educated on the procedure and didn't know better.
Yeah, no, I agree. That's so true. I see that every day as well. Overdone fillers, overdone lip lifts that shouldn't have been done in 20-year-olds. These are all things that are just practical stuff. Know before you go. And just because an influencer has it or it's on some Instagram or social media site doesn't make it right. And I think that's where, I think you and your company, the beauty brokers, have actually been a great equilibrator for that, because you're saying, hey, this doesn't make sense. A 26-year-old getting a facelift, that's crazy. And, I think, know before you go. And I think, by the way, when you have haters, that means you're doing the right thing. Haters always hate. So I always, I had a friend of mine who's a plastic surgeon, and he's becoming more well-known, and he's getting some negative things said about. I said, you know what? You finally have reached a new plateau. That's a good thing. I said, join the world and look at your back, but, it's a good thing when you're saying things that are truthful. A lot of people aren't going to like that. That's okay, as long as you're being honest with yourself and you're helping others. Go for it, and I think you're doing that, and I think that's kudos to you. So
thank you.
Stand tall.
Thank you.
Stand strong.
Yeah, people going overboard, and the doctors who aren't saying no to the patient. Doctors need to practice how to say no a little bit more often these days. Don't let the patient dictate to you how to do your job. You are the surgeon. You know what is best for the patient, and don't look at it as they're just dollar signs walking into your door. These are human beings. Like Dr. Hidalgo always tells me, and he always hammered into my head, it is a one-time event for the doctor, but this is a lifetime event for the patient, and this is going to affect that patient for the rest of their life.
Exactly.
Do the right thing.
Yeah.
It's karma at the end of the day. Do the right thing for your patient. That is so important.
That's true. It's true. And karma is real. It'll come back.
Karma is real.
It'll help you or haunt you. So you want it to help you. wise words, Melinda, wise words. Beauty brokers, go see them. If you have any questions about, or any doubts about what you should be doing, or is that the right surgeon for you? I mean, I think the key in plastic surgery is most of the time, the outcome and the safety of your result is highly dependent upon who you choose to do your plastic surgery. I can tell you, I see that every day, and I go, because almost half of my practice is revisional surgery and rhinoplasty and facial rejuvenation. And
half of my consultancy is also revision surgery and facial plastic surgery.
I know, and because one thing I see is that the revision patient is far smarter, and they've done the homework that they probably should have done the first time. And so there's a lot of regrets. But we always move forward because we say, the past is the past, and that's why, the rearview mirror is small and the windshield is large. You always have to look forward. And today is all you have to live for, and that's the present. So thank you so much. So tell us, a couple of final comments on what should someone, or what did you tell that 26-year-old who came to see you? She should have seen you a year ago. What did you tell her?
Right. I know. I said that to her when she came in this morning. I said, you should have come to me before you made this decision. They all say the same thing. I wish I would have known you.
Yeah,
we do no advertising. So, you could find me on social media, but we do zero advertising. I tell them, listen, don't make rash decisions. This is your face. You only get one face. You've got a long life to live. You've got plenty of time to do these types of surgeries. After 40, you're really going to start seeing the aging. So don't put scar tissue in your face or body too early on in life. Wait, enjoy your youth. This is the best you're ever going to look, so enjoy your youth. Don't rush into doing these types of procedures. You're beautiful. You don't need it. Most of these young girls don't need it. And in fact, when they do these procedures, it makes them look older.
Exactly.
So, I noticed that a lot, actually. This young girl had beautiful facial features and structure and, beautiful bone structure. And she got a face full of fat grafting. It was just horrendous. I'm like, it didn't look good. But I'm like, we're going to try to reverse some of this, and we're going to get you to the right practitioners, and we're going to try to undo and get you back to where you were at 24.
Yeah.
So she's really happy about that, and she's getting married, and, I want her to be happy. But I hate to see these young girls fall victim to that. I mean, listen, I was an 18-year-old who was convinced by a dermatologist to inject my lips with silicone.
Oh.
Go figure, me of all people. But he was a very famous derm in New York City, and I did it. And it's the biggest regret of my life, Dr. Rohrich. It's the biggest regret of my life. Yes, when I was 19, I had a rhinoplasty, best decision ever. Dr. Sam Rizk, phenomenal.
Great.
And then I also had at 41, which was probably too late, a breast reduction. Also, best decision I ever made. That was long overdue.
Yeah.
But I don't regret those things that I made smart decisions, but I regret the lips, of course. But I never want my clients, especially, to look back on their life and say, why did I do that? I was so pretty. Why did I ruin my face? Why did I ruin my body? Enjoy your youth, enjoy your body, enjoy your health, go out and enjoy your life. That's the most important. The memories you make are important, not the procedures that you do.
I agree. Right. Wise words. The beauty brokers. Amazing. Linda, thanks again for coming on Rohrich Knows podcast. Phenomenal. And, thank you so much again. Give us your comments and thoughts, and we'll share them with Melinda. Thank you again, and enjoy helping you become a better you.